Hey everyone, welcome to Meddkit's Provider Spotlight, where we are interviewing really awesome private practices, amazing providers that have very unique stories, unique modalities that they use to help people in their communities. So today we have our very first podiatrist. We are very, very excited to introduce you to Dr. Debra with Step by Step Family Foot Care as our guest speaker. Thanks, Dr. Debra, for joining us.
My pleasure.
We're excited. So we're going to dive right in. Very excited that you're a first podiatrist. Tell us how your approach is different.
Um, I treat my patients the way I treat my family members. My patients tell me that I am more thorough than most of the doctors that they've been to. Um, my appointments are generally a little longer, and we look for the not just putting a Band-Aid on the problem. We try and find the underlying source of the problem and treat the underlying source to get rid of the full issue.
Yep. I totally agree with that methodology. I mean, some people, treat symptoms, but I love how you dive in and say, that may not be the cause. What you're feeling may be something else. And so diving into that and figuring out what is actually causing your issue is really important. And then once the root cause gets established, you can actually start working on an effective treatment, right?
It's not just treating the pain or the swelling. It's, well, why is it swelling? Why is there pain? What do we have to worry about in this individual? It depends on their metabolic, what other medical problems they have going on that need to be looked at. It's not everything is just surface.
Yep. Totally understand. And what do you wish people, or what do you want them to know about podiatry, their feet, their ankles? What do people don't understand?
Well, first of all, there has to be an understanding about what podiatrists do. There is the understanding that podiatrists only cut toenails and shave calluses.
Yeah.
And that is a huge misconception. Today's podiatrist has at least 3 years of residency training. There's fellowships that are done to further specialized care. Today's podiatrist is a surgeon, a wound care specialist, a sports medicine specialist. There's those that specialize just in pediatric foot care. We treat toenails, we treat dermatologic issues, we treat nerve issues, we treat the foot. There's more bones in the foot than any other part of the body, and
Wow.
we treat bone, soft tissue, skin. Um, we take care of the feet.
It's interesting. I'm really glad that you brought up those misconceptions because I'm sure a lot of people who are watching are saying, oh, yeah, I know what this is about, but they don't. And I loved all the different things that you listed that you do and that you are. So I'm really glad that you were able to talk about that. And in terms of, some of those trickier cases, what are those and what other modalities do you use to help people?
That is a $1 million question because I'm going to answer it from two different perspectives. There's the conservative spectrum and there's the surgical spectrum. I very much lean toward the conservative spectrum, so that it depends on what the problem is. You ask for interesting patient issues. I have a lady that was just in today who came to me probably a year ago. We started that she was seen by another doctor for 4 different problems, and they just completely that, um, missed her diagnosis in particular, that she is not a diabetic, but she had problems similar to a diabetic, where literally the bones in the middle of her foot had fractured and were not diagnosed, and they were moving out of alignment. It's called Charcot. neuroarthropathy, but just A, making the proper diagnosis, and B, knowing what the diagnosis is and then treating it the right way, gave this lady her life back. She couldn't walk, she couldn't do her avocations because of pain. That's one type of patient, and that type of patient can be treated conservatively sometimes or surgically, which are some of the more extreme, interesting cases that podiatrists see. I don't do a lot of trauma medicine. There are podiatrists that are reconstructing the feet because of injuries. That was kind of the fun stuff I did in residency. Now I have interesting wound care patients where there's, a lot of different ways that we have to treat the wound, and we have to look at both their nutrition status as well as what their functional status is and what products are available to be able to get them to heal, to give them their feedback so they can walk.
No, I like that. I mean, you have a really holistic approach. You take a look at everything and to get to that root cause, and you have to. And so I love that it's not just, oh, it's this thing. Let's dive in, root cause. Now we have a real diagnosis. Now we can have a real treatment.
Correct. It's not always, well, let's just put the shoe on and you'll be fine.
Yeah.
Doesn't work that way.
And I'm sure a lot of people that you've seen have gotten, not a lot of help or, have felt helpless in their diagnosis. It must have been really tough.
Maybe that I was telling you about from today, her path to my office was very frustrating for her because it was 1 or 2 years of multiple failed treatments. And that gets very, very frustrating for patients. Patients want to walk without pain. And that's what our job is to try and make that happen to the best of our abilities.
That's amazing. And what are some easy tips? People that, maybe they're young. And there are young people that have problems too, right? But what are people that may not be thinking about their feet right now? And what do you wish people would know about proper foot care? And what should everyone be doing as a standard to take care of your feet for longevity or anything?
Well, I'm going to start with number one, pain is not normal. So if there's pain, that should be worked up. Pain is not normal. Your question runs the gamut because for different people, what their baseline needs to be is very different. For a young patient that doesn't have medical issues, it's more about keeping the nails trimmed straight across. It's about keeping your skin well lubricated or moisturized. It's about checking to make sure you don't have any issues or that there's no bruising, no blisters, nothing like that. For the diabetic, that's a different set of issues because you have to worry about sugar control, you have to worry about loss of sensation, which is very common to the diabetic, where you have to make sure that feet are being checked regularly because a diabetic problem can change literally in a matter of hours. For the sports individual, the sports focused individual, you have to worry about proper preparation for their sport, that there's minimizing the chance for injury, whether it's needing an insert in their shoes, whether it's needing a special brace or wrapping or taping. It's making sure that they're prepared for whatever their journey is. So there aren't true hard and fast rules, but different people require different things.
No, I love that. I mean, yeah, everyone's different. Everyone has also different goals, doing different activities, and have different health, future stories, and so yes, yeah, everyone should be treated differently. And I love that there's not just one shoe fits all, right?
No. No, one she doesn't fit off.
And so I like that for everyone listening that hey, you might fall into one of these categories and there's different things that you can be doing to better your foot health. You should be doing certain things to get to where you need to go on your feet and not be in pain because it's not normal. And I love that. There's a lot of us that pass by and say, "Oh, this hurts, that hurts today." Even me, this hurts in my foot. It's not normal, but we try to normalize it in our brains, right? We try to say, "Oh, that's for later." Well,
Oh,
it'll
well, it'll be better tomorrow. Give me a week and it'll get better.
yeah,
Not everything resolves on its own.
yeah. No, I love it. I think this was extremely helpful. I love that you gave so many examples for so many people that are in so many different situations and they're broad. Like something that I think a lot of people didn't know today is what you do as a podiatrist is extremely broad. And so I think if someone takes one takeaway today is it's not just one thing, not just one thing.
Podiatrists today have a lot more training and a lot more breadth of knowledge and a lot more skills, and what the newer and younger podiatrists can do surgically is just amazing. It's just amazing that how much in the last 20 years the surgical side of the field has changed.
That's awesome. It's amazing to hear, and I'm glad you were able to tell your story here, how you help your patients, your community, and for the people that are watching, Dr. Deborah, can you tell us how they can get in touch with you, how to, um, you know, go on your website, track down any questions or more, answers, really? That would be great.
Um, to reach my office, it's a phone call. It's 973-917-3785. My website is www.stepbystepnynj.com. In real words, it's stepbystepnewyorknewjersey.com. And they can email me directly at drdeb@stepbystepnynj.com. I'm located in Parsippany, New Jersey.
Awesome. Thank you so much, Dr. Deborah. We really appreciated your time, your answers, and your knowledge, and we hope to have you on again soon.
Thank you, Rachel.